Hi, hello everyone. It's really great to have you. I think we have a lot of participants now. We can now begin. So welcome to our third and final webinar of our mini science series, and it is titled Digital Health, a Step Towards Modernized Healthcare. Thank you so much for taking out the time and to be with us today. So for those who have joined us on our first two webinars about pandemic preparedness and adapting to the new norm, we're so glad to have you again. And for new attendees, we extend our heartiest welcome to you too. And we look forward to see you participate in the amazing conversations we'll be having today. So my name is Nishad Anand, and it is always a pleasure to be your host. So I'll be launching a short poll to check if you can hear and see as well. So let us know. Can we have the poll, Herman? All right, I think we can go ahead. Okay, so to just go forward, and because I think most of us can hear and see us well. So before we begin though, so I would like to go over a few items so you know how to participate in today's webinar. So this webinar will not allow you, okay, so the poll is up now. So there was an issue with Zoom, but I think the poll is on, and yes, thank you so much for participating in the poll. I think, yes, we can see that most of us can hear and see as well, so thank you. I'll just end it right now. All right, thank you. So just to head back, this webinar will not allow you to switch on your webcam, and all attendees will be muted, but we'll be enabling our Q&A feature throughout the webinar. It is below on your attendee control panel, so if you have any questions, just pop them in there, and we will have them addressed at the end of the webinar, which will be our Q&A session. We'll try our best to answer as many questions as our time permits. Please note that this webinar is being recorded, so if you miss anything, don't worry. We'll be sending around the recording upon request when it's available. All right, so let's just dive in. To give you a quick background, the Mini Science Series is a very special set of online webinars brought to you by the organizing committee of Monash Science Symposium 2021. An incredible legacy laid out through the years by postgrad students from the School of Science here at Monash University, Malaysia. So these webinars are structured to highlight important global topics and welcome the voices of diverse and crucial fields of expertise to come together and share a meaningful, informative, and engaging conversation made available to absolutely anyone interested to tune in, completely free of charge. Today, we are here to talk about digital health. Now, digital health can be explained as the simple concept of utilizing technology to help improve health and wellness among people. From mobile health apps that support the clinical decisions of doctors to artificial intelligence, digital technology has been driving a revolution in healthcare. This industry is driven to focus on disease prevention, helping patients monitor and manage chronic conditions, and lowering costs of healthcare provision, and making medicine just more tailored to individual needs. We have lined up a fantastic panel of speakers who are here to share their unique experiences in contributing to digital health, and also to walk us through the advancements that we have made so far and the true potentials of heading towards what is next to come. So let me take the time to introduce who are with us today. So today we are extremely pleased to have Prof. Qasim Ayub as our chairperson. He is an associate professor in genomics at the School of Science here at Monash. He is also the school's current deputy head of research and the director of the genomic facility. Prof. Qasim is truly an esteemed researcher in the field of population and evolutionary genomics. Naturally, he has been a part of several impressive projects, and he currently leads the Malaysian Biogenome Project, and he's interested in studying DNA variations in the orang asli. He discovered novel male-specific markers that are routinely used for forensic screening, and for this he was awarded the President of Pakistan's Medal of Excellence in 2006. He had also been a member of the Human Evolution team in the world-renowned Wellcome's Trust Sanger Institute. All right, so we have also lined up an exciting panel of speakers today. So we're just going to begin with Mr. Hafiz Naimun here, who is the Business Development Manager at Naluri. So Naluri is a leading digital therapeutics company that aims to address one's emotional, mental, and physical needs in order to improve overall health. At Naluri, he works closely with large corporates, healthcare providers, and pharmaceutical companies to deliver affordable and convenient access to structured multidisciplinary health coaching to the population. Next, we have Dr. Ting Chi Ming, who is an associate professor in the School of Information Technology, also at Monash. His specialty lies in machine learning and data science. His research interests also include signal and image processing, deep neural networks, and statistical models for networks with neuroimaging applications and other biomedical data for automatic prediction of diseases and patient monitoring. He also won several national and international innovation awards for his work. And lastly, we are beyond grateful to have Dr. Fazila, who has an incredible 25 years of experience in the Ministry of Health. Dr. Fazila is presently the Senior Deputy Director of the Planning Division. For over a decade, she has been leading digital health and innovation strategies and collaborations both locally and internationally. She often represents Malaysia at regional and global platforms for digital health. We will have time to hear from each of these speakers today. This will be followed by an open floor discussion between the speakers. You are strongly encouraged to ask questions throughout the webinar to have them answered at the end in the Q&A session. So once again, welcome to our final webinar of the Mini Science series. So stay with us as we hear from our really great speakers that we have today. And without further delay, I'll be handing the floor to our chairperson, Prof. Qasim, to open the discussion.
Thank you, Nisha, for that introduction. I'll just share my screen.
Yes,
and
sure.
It's thank you to the organizing committee, Monash students, particularly Christy, Nadhuri, Nisha, and Herman, and all the others who are involved with organizing this seminar series. It's a pleasure for me to be chairing this session with three prestigious speakers today. So we will be talking about digital health, a step towards modernized healthcare, and I think the speakers will tell us how far we've come in this. So what is digital health? So what I understand from digital health is it includes digital care programs, basically a convergence of digital technologies, the Internet of Things and artificial intelligence with healthy living in human societies, to basically enhance the efficiency of the healthcare delivery and improve our general well-being. And of course, it's related to a lot of different aspects, such as clinical diagnosis, health analytics, visualization of images and genomic data in some instances, and basically integrating all of these in improving our healthcare. So why is this important? So it's really important for monitoring health, and this is increasingly being done by technologies such as wearable technologies and apps, which most of you are familiar with. They can track our blood pressure levels, our blood sugar levels, heart rate, calorie count, BMI. And so you can basically wear sensors that can track your day-to-day physiological well-being. It also allows individuals to improve their lifestyles, maintain good health, and a healthy lifestyle. As you know, that Malaysia is one of the countries that there is a population which is increasingly aging. So this becomes very important for longevity and for improved lifestyle in older age. It also then, these devices also help in identifying illnesses earlier or preventing existing illnesses such as diabetes from getting worse. So basically, it's changing the way that we monitor our own health. And of course, this then results in reduced cost on healthcare and hospitalizations. It also provides an easy access to healthcare, particularly in remote, far-flung areas. And overall, it all is aimed towards reducing inefficiencies in the healthcare system and preventing wastage. And of course, you can use these predictive data analytics and that several healthcare providers are currently using to tackle inefficiencies. You can integrate clinicians from far-off areas to provide medicine in rural areas through telemedicine. You've got administratives that can look into these data sets and proactively manage potential issues that may arise. And then basically the idea is to streamline all the information that is out there, manage the patient flow, simplify staffing and funding, and eliminate basically the wastage and both of the hospital staff and the other auxiliary staff associated with healthcare, and lead to a positive experience for people who suffer from diseases. And of course, also a major part of it recently is genomics. And genomics is basically where you understand the whole genomic or genetic material that makes up an individual. And then you tailor medicines that are focused on their disease or genetic makeup so that they don't get adverse reactions and they benefit from the tailored drugs. And this revolution in personalized medicines really picked up in the last decade, basically with the cheap provision of sequencing and genotyping datasets. Of course, many countries have launched their own personalized genomics sequencing datasets. I'm just highlighting a few that were published in the American Journal of Human Genetics a few years ago. The major programs are, of course, in the United States, the All of Us, which is essentially going to sequence 1 million US residents. And then, of course, Genomics England, which has already sequenced about 500,000 of residents in the UK. And these are basically a mixture of clinical diagnostic-based sequencing as well as healthy individual sequencing to understand the baseline genetic variation and see how it varies with disease conditions. So why is this important? The rise of on-demand healthcare is really, I think, the future. And patients want healthcare based on their own convenience and schedule. And of course, the big data that's being generated by monitoring constantly and looking at these big genomic and biological data sets is really important. And how to analyze and make sense of that data is what artificial intelligence and other bioinformatic algorithms are used for. We're, of course, augmenting patient treatment with virtual reality, wearing medical devices, predictive healthcare to diagnose disease early and also to predict the outcome of the disease. And of course, artificial intelligence is going to be helping us in this. I'm not the expert in this field, and that's why we have these three amazing speakers today we're going to talk about the importance of these technologies. However, one thing, I mean, not all these technologies both have a good edge and a bad edge. And of course, we can't get away with certain issues that are associated with it. The main issues that we deal with are storing all this data that costs money, wastes energy. And of course, then how to protect and manage all this data is something that people associated with healthcare are really looking seriously into. Of course, there's privacy issues, particularly for genomic data. It not only displays information about yourself, but also about your siblings, your parents, and your future generations. So it doesn't affect only you, it also affects other members of the human family. And of course, there are likely to be health inequities. If you notice the slide that I showed, the countries where the personalized medicine projects are ongoing, most of them are well-developed countries that can finance these studies. And so that's going to lead to a healthcare system in which some countries and people who have access to this large funding will have their genome sequenced, whereas other countries might not, and that will lead to health inequities. If people read today's Nature, last week's Nature issue, there's a big initiative in sequencing 3 million African genomes. These are healthy African genomes across the African continent. And really the aim is to capture the biodiversity, which is greater in Africa, but also to make sure that once these healthcare activities are translated onto the field, these health inequities are less and people don't suffer from them. So I think that's all I wanted to talk about. And I'll stop sharing my screen. And I'd really like to welcome all the three speakers that we have today, who are really the experts in this field. And I'd like to introduce our first speaker today. So it gives me great pleasure to introduce Mr. Hafiz Nemul, the Business Development Manager from Naluri. He'll be talking about the development and inspiration behind Naluri and why it's important for us to move forward in the direction of digital health. So, Mr. Naluri, if you can share your screen or if you have a presentation.
Yeah, thank you so much, Prof. Kasim, for the warm welcome. Let me just share my screen and let me know if you guys can see this. All good? Awesome. Thank you so much. And then, of course, thank you to the committee for organizing this event and allowing myself and Naluri to be a part of it. Now, I wanted to talk about a few things today around this kind of overarching theme of digital health and also what we specifically are doing over here at Naluri. But I think it's important for us to first get a sense of the current state of health and healthcare that we're facing to better understand kind of not only why this shift towards digital health is so important, but how we can be more conscious and thoughtful about the way we use digital technology to ultimately drive towards what we want, which is, as Prof. Kasim touched on, is improved access and improved health outcomes that we can ultimately sustain over the long term. Now, long before the movie Contagion became a bit too real for us and our lives were dominated by the global pandemic, it wasn't all sunshine and rainbows before this, right? There was another more silent pandemic that claimed tens of millions of lives a year and affects about 1 billion people in Asia alone. Non-communicable diseases such as cardiovascular disease, diabetes, obesity, has been crippling healthcare systems across the globe, right? And in Malaysia specifically, 13 million Malaysian adults have either high blood pressure, high cholesterol, or high blood sugar. And that's 2 out of 3 Malaysian adults, right? And this is a trend that we've been seeing worsen over the years, essentially making Malaysia the unhealthiest nation in Southeast Asia. In fact, in terms of weight and obesity, we've actually overtaken our neighbors to officially become, the fattest nation amongst ASEAN countries, where 1 in 2 Malaysian adults are actually overweight or obese. Now, if you couple that with having one of the highest medical cost inflation rates in the world of about 17% at the top end, we have a situation where, the government, employers, and insurers who really bear the burden of these healthcare costs are really just paying more and more money year on year for care, yet people are getting sicker and sicker. Now, aside from these chronic conditions, really, if there's anything we can take from the COVID-19 pandemic that's positive, one of the things is that it really has shone a spotlight on things like depression, anxiety, and stress, and really essentially brought to the front the importance of mental health, right? And so as part of the work that we do at Naluri, we've had the opportunity to actually screen and measure and really quantify the mental health severity levels of thousands and thousands of our users across things like depression, anxiety, and stress. And in fact, over the thousands that we've screened, we find that about 40 to 50% of these employees actually have elevated levels of mental health risk. So across depression, anxiety, and stress. Now, on top of that, with the current pandemic causing, uncertainty, huge disruptions to people's lives and their businesses, the number of people that will experience these kinds of emotional distress is only going to rise. Yet we will still struggle to provide access or for them to gain access to mental health support. In fact, when we look at the usage of kind of traditional mental health services across companies in Malaysia today, only about 0.5 to 2% of employees actually reach out, even though about 40 to 50% of them actually have elevated levels of mental health risk. So there's clearly a disconnect or a gap that traditional kind of support services are not addressing. And so one part of this issue is that we unfortunately come from, a part of the world where mental health is still very much stigmatized. Strong cultural barriers still exist to seeking out mental health support. First of all, mental health in Malaysia is not as mainstream as it might be in places like the US or Europe. And so people are less likely to identify the issues that they have as psychological distress. For employees as well, a lot of people generally will be concerned about the impact it might have on their jobs or their impression that their coworkers or bosses might have if they were to seek mental health support. There's also a very strong, general stigma associated with mental health problems. Some parents may still think that they will tarnish the family name if their children seek out mental health support. And we unfortunately still hear words like crazy associated with mental health issues. Now, the other side of this issue is simply the lack of supply of mental health professionals. And to kind of paint a picture of the severity of this issue, according to the WHO, for every 100,000 people in the population, Canada has 15 practicing psychiatrists to serve them. That's about a ratio of 1 psychiatrist to serve 7,000 people. In the US, it's about 11 psychiatrists, or a ratio of about 1 psychiatrist to serve 9,000 people. In Malaysia, that number is 1 psychiatrist to serve every 100,000 people in the population. And for psychologists, it's an even lower number. Now, when you start to think about how small that number is in relation to our population, it really gives a sense of the shortage of mental health professionals in Malaysia. And if you think about it, this issue will really be exacerbated for people in rural areas and states like Kelantan and Terengganu, for example. Now, digital healthcare overall can be a great facilitator and essentially allows for healthcare professionals to break down these geographical boundaries, which is extremely important, right, in helping get care to individuals in a time like this where, travel is restricted and seeing a psychologist may still be a very taboo topic. However, while the shift to solutions like online telemedicine platforms might help with issues related to accessibility, we still need to take a essentially higher level approach and rethink how we deliver healthcare and the way in which we digitize the solution in order to address really the key issues that we see with kind of the existing healthcare models, right? And so what are they? First, most of healthcare today is what we will call reactive and transactional, right? And what do I mean by that? Essentially, people typically wait until they are sick, and only then do they go see a doctor, whether at a hospital or a clinic, or booking a session with a doctor online through telemedicine platform. And through that consultation, the doctor may, assess the patient, provide a diagnosis, maybe a prescription, and then the patient goes home. This French model doesn't really work well with chronic conditions like diabetes, heart disease, cancer, and even mental health issues, which can't be fixed with just single sessions or single procedures, right? Care for these types of conditions is needed over months and months and years to help the patients change their lives and actually become healthier. But it's a double-edged sword, right? With more frequent interactions where healthcare professionals start to move towards transactional consultations and one-off sessions to ongoing coaching and monitoring, it simply becomes too costly if it requires frequent one-on-one sessions. It also becomes a lot more inconvenient if we now have to force the patient to block specific times in their schedule to connect with the healthcare professional multiple times. And as we've just seen, in Malaysia, in this region, simply increasing the frequency of interaction will create a supply issue just because of the woefully lacking in healthcare professionals, right? And so we need to see a change in this kind of reactive transactional model of care to something that's a lot more ongoing, structured, programmatic, which incorporates behavioral coaching, psychological support, and monitoring, but done in a way that is accessible, convenient, and affordable. Now, the next challenge is what we see very much in kind of existing healthcare solutions, especially digital health solutions now, is that it's very much activities-based and not outcomes-based. And what I mean by that is we tend to focus on tracking and delivering activities like, you know, the number of steps taken a day, the number of calories, which is important and has its place. But when done in isolation, these health activities might not actually generate measurable health improvements. And if they do, we don't have sight on how much the improvements are actually that are achieved. And so it's important to move towards solutions that are anchored on measurable outcomes, improving actual health metrics like weight loss, blood sugar, blood pressure, cholesterol, and even quantitative improvements in depression, anxiety, and stress. Now, the final limitation essentially is that we see is today's healthcare delivery is very siloed and specialized, right? And what I mean by that is if you were to go see a cardiologist, they will focus on your heart. If you were to see a dietitian, they'll provide advice relating to your food and your nutrition. A psychologist will help improve your mental health. But very rarely will they actually coordinate between each other when delivering care to a specific individual. And we know that, you know, health and in particular chronic conditions are very, very interrelated. There are clear correlations, for example, between diabetes and depression and heart diseases and anxiety. And so we envision, and it's important to move towards a model where we move away from just simply single doctors and specialists to something that is more coordinated, multidisciplinary, that actually puts the patient at the center of the care rather than making the patient see, you know, individual specialists and having them to figure out how different aspects of health and medicine fit together. And so a digital solution can provide the platform for those multidisciplinary health professionals to coordinate with each other when delivering care to a patient. And so really solving these issues is essentially how Naluri began, right? And we are trying to use the power of data and technology to change the landscape of chronic care and mental health in Malaysia, essentially making it accessible and affordable and effective in terms of health outcomes. And so how do we do this? To go back to the mental health example, right? The result of such a low supply of psychologists is that the cost to receive therapy is incredibly high, right? It would cost you around 300 ringgit to have a single face-to-face session with a psychologist. Now, this is because a psychologist would need to physically be there face-to-face to provide you with this type of therapy. And even with virtual sessions booked through something like a telemedicine platform, it is still a one-to-one interaction, and you need to block time for both yourself and the patient to conduct the therapy. So we first need to break this one-to-one matching issue. And through digital therapy via a platform that is geared towards ongoing and continuous chat, a psychologist is now able to, instead of just seeing simply 40 patients at any given time, they're now able to see 400 patients simultaneously at any given time. By doing this, we can also greatly reduce the cost to serve any individual person, because you start moving away from a patient paying multiple sessions of one-off consultations or visits, going to a single fee for continuous service or continuous care over the same period of time. We don't just do this for psychologists, right? I touched a little bit on multidisciplinary care just now. We surround the user with, you know, a set of multidisciplinary health coaches, not just a psychologist. We have dietitians, fitness coaches, doctors, pharmacists, and even career coaches and financial planners all working in tandem with each other to deliver care to a user. And essentially our user will get unlimited access to chat with all of these professionals over a few months for less than what it would cost to have a single face-to-face session with a psychologist. Now, in addition to this coaching, we also supplement the whole coaching journey with evidence-based digital tools. Food, for example, makes an enormous impact to both our physical and mental health, right? And so we've designed an AI-powered food journal to essentially track food intake over time, and we can see improvements in as little as 2 weeks in. What's important is that, you know, food tracking can be very tedious, and so for us, we tried to design it as seamlessly and frictionless as possible. And as many of you will know, taking pictures of our food before we eat is like a national sport to us, right? So all they have to do is snap a picture, upload it onto the food journal, and then on the back end, our dietitian can provide a rating and a personalized comment on all of those food entries. And then over time, they can start building overall awareness of how healthy they're eating, and if any particular meal is not healthy, what are the small changes they can do to actually improve their health. Our thought journal is centered around cognitive behavior therapy and is essentially a space for people to log their positive or negative thoughts, which allows our psychologists to identify kind of thinking patterns and thinking traps that the individual might have. And if the user allows the psychologist to actually go in and view the thought journal entries, it can then spark a conversation around the stressors that an individual might be experiencing. We also have digital educational modules that is kind of bite-sized chunks that users can work through at their own pace, covering things like diet, exercise, stress management, self-care, further improving our coaches' productivity, but also providing additional data points for the health coaches to use to tailor their advice and their coaching to each individual. A planner feature essentially allows the patient and the coaches to set challenges like food and exercise related challenges, but also acts as a reminder for people to adhere to medication prescriptions, for example, or a reminder to take a picture of your food and upload it for kind of food journaling purposes. One of the other core elements of the program is something Dr. Kasim also touched on, which is connected devices, right? And so it's important for us for the patient to be able to develop their kind of self-monitoring capabilities. And so we provide things like Bluetooth connected weighing scales so that our patients can digitally track their weight loss in a kind of frictionless manner, right? They just have to stand on the scale. The reading automatically connects to the app, and then over time they can start tracking the fluctuations in weight, and the coaches can actually get a view of the fluctuations in weight as well. We also have an in-app steps tracker, and those who have glucometers can also track their blood sugar over time. So those are essentially the core components of Naluri. Most importantly is, as I mentioned before, anchoring our programs on delivering quantifiable health outcomes, right? And at the start of our program, we can see a clear correlation between physical and mental health risk. And what this chart shows is essentially if we measured a population in terms of their physical health risk, mental health risk from low to high, and then plotted it in a chart, we can very clearly see a positive correlation, i.e. those who have high physical health risk typically also have very high mental health risk. And after 4 months with Naluri, 60% achieve clinical signals of both physical and mental health markers. This represents, a reduction in future chronic disease risk of about 30 to 50%. And we've consistently done this over kind of repeated cohorts who enroll in our program. So why is this important? Helping one individual to avoid chronic disease risk represents a 10-year economic value of about $20,000 US over 10 years in both direct medical costs, but also indirect costs for things like absenteeism, presenteeism, productivity loss. And this is really our goal, right? To do the same for the millions in Malaysia and kind of Southeast Asia suffering from chronic disease and mental health. And by utilizing a digital platform, it really will help us scale the care that we can provide to the people in Malaysia and Southeast Asia. And so I wanted to end with some thoughts on how the landscape might evolve over time. I think we're all excited, about the changes that digital health will bring about. The way of working across, I think all healthcare professionals will drastically change across the next 10 years. We'll have access to more data and decision support tools, and care will start to move towards being more non-hospital based. I think because of this, we will embrace the technology wholeheartedly. But what is very clear is that it's important to recognize the fact that human empathy will be the center of care and can't be completely replaced by machines, which is why it's important to really push towards human-led but digitally augmented solutions, and which is what we're trying to do at Naluri. I think what will really drive the acceptance and adoption of digital health solutions like Naluri in a kind of mass market way is really our ability to demonstrate and deliver actual measurable improvements for the people that we serve, right, across physical health and mental health, and the sustainability of these improvements and how that translates into long-term economic value created through a reduction in healthcare costs. And obviously this will be a long journey ahead, as we need to work with all the different stakeholders, the payers, the providers, government in the healthcare system to really reshape the healthcare ecosystem to start really accepting these forms of interventions on a kind of mass market basis. That's essentially what I wanted to share. With that, I'm super excited to hear from Dr. Ting and Dr. Fazila on their thoughts about AI and digital health. We do incorporate AI into our solutions, and so excited to see what else is being worked on in that space. To our audience, unfortunately, I have to drop off before the Q&A session at the end. But if you have any questions, I'll be sticking around during their segment. Drop questions in the chat and I'll answer them in the chat. I've also shared my email here, and so feel free to reach out to me for anything. Thank you so much. I guess back to you, Prof. Kasim.
Thank you so much, Hafiz, for that illuminating talk on Naluri and all the options that are available. If you have any questions, just put them on chat. So the next speaker is Dr. Ting Chi Ming, Associate Professor from the School of Information Technology at Monash University. He's going to be talking about the role of AI in healthcare system and discuss the potential challenges in the process of incorporating artificial intelligence into existing healthcare system. Can I please request the speakers to limit their talk to around 15 minutes so we have enough time for discussion and question and answers in the end?
Okay.
Thank you, and I hand it over to you, Dr. Ting.
Okay, so I will share my screen.
Yeah, please.
Okay, so can you see my screen? Yeah.
Yeah.
Okay, so thanks, Prof. Kasim, for the kind introductions and the mini science series for inviting me for this sharing. So I thanks Hafiz for talking about the background and the constraints of our current healthcare system, right? And potentially the data analytics and the AI can provide solutions, right, for these problems. Okay, so we'll talk about I will just illustrate some applications of the AI in the medicine and in the healthcare. So actually, this age is actually a golden age for AI. So it has been adopted in numerous sectors, right? So healthcare is one of them. So, and you can see the digital technology has been evolved tremendously, right? Starting from the 80s, we have a PC and then internet. So the mobile, so we have all the necessary hardware, right? So now it's about the future is projected to be the artificial intelligence. So now we are trying to make the machine think, right, like human, right? So, okay, so as all you know, AI has impacted and is impacting our lives, right? So even in Malaysia, we have already made history. We actually use the AI for sentencing in court, right? So, and of course, in Facebook and Amazon, you have this recommendation system, right? Recommend friends to use and which book to buy, right? So, but underlying the technology is a bunch of mathematical algorithms and a model, right? So, and things like that. So it's a AI. It's an underlying technology. So it's an enabling technologies behind these systems. Okay. So I will talk a bit about technological development in the AI, right? So since the Alan Turing introduced the first Turing machine in the 50, right? So it's already evolved a lot, right? So in 1997, the IBM Deep Blue beat the world champion. So and then in 2016, the Google DeepMind AlphaGo beat the Go champions. It's a very complex chess game, right? So this is just give you an impression of how the AI evolved just a few decades. So you can see the investment in the AI is growing rapidly, right? So you can see especially in the healthcare, so the AI in the healthcare is projected to worth 36 billion by the year 2025, right? With the North America is taking the lead. So, and then in AI for the medical imaging market is projected to reach 1.5 billion by the 2024. So, okay. So you can see, of course, as a researcher, so this is actually also the golden age for us. So it's, as you see, the number of publication in AI research is growing exponentially, right? So in recent years. So what contribute to the growth of AI research, right? So first, of course, it's the rise of the big data. So data is being collected in large amount and in an unprecedented speed and a variety, right? So like images and signals and all the behavioral data, when you click a Facebook like, then your data is being collected by the Facebook, right? And then of course this is, of course, we have a more efficient machine learning algorithms, right? So we have recently we have deep learning, right? So and rise of big data is a good news for deep learning. So we can use data to train more accurate models. So another, of course, is this is made possible also by improvement in the computing resources, right? The hardware. So we have now we have a GPU, so which enable us to run the algorithm faster, right? So and then of course we have an improvement in the memory storage. Of course, thanks to the adoption by the various fields and industries, right? And which invest a lot in the AI recently. So okay, so actually these factors work together and contributing to the growth of AI recently. So of course, one of the major breakthrough in AI is deep learning. So of course, so we have this deep multi-layer deep neural networks. So it's actually artificial neural networks, which actually try to imitate the real neural networks of our brain, right? So and we have these computational units. So like you have these neurons, which are and then these connections, like we mimic the synapse in our neural system, right? So and then which the networks can take the input images and then try to output some probability and the score for prediction. So this is basically the underlying algorithms and the machine learning model behind the AI success. Okay. So of course, then this algorithm give a leap forward or the significant increase in the classification performance, like in image classification, so like the face detection, like also you have also this lead to improve performance in the speech recognition system. So how about and then just give an impression for you the rise of big data in social media, right? So you can see there's a 2.9 million of emails sent every second, and then 50 million tweets per day. So and then 700 billion minutes spent on Facebook each month. So But I think this data is a bit outdated. So I think it's the real situation is more than that. So okay, now I will talk about the big data in healthcare. So in healthcare, so we large amount of electronic health record is being collected. We have medical imaging and genomic sequencing, and then for pharmaceutical research and also the wearable devices, right? So so especially actually the human biological data is being systematically collected. What we call is biobank. So like in a UK biobanks, right? So from one patient, so we will collect their lifestyle, medical history, right? Like the genetic data, and also their imaging data, like the brain imaging, and their physical activity and the cognitive function, like their emotional score and the IQ score. So this data is provided important resources to support like the medical research, like for we can analyze this data, and for the potential application for the personalized medicine, like to predict the outcome of a treatment, and then predict for the pre-screening of certain diseases, and the monitoring of the psychological condition of the patient, right? So okay. So I just borrowed this picture online. So this gives you a overview of the application of AI in healthcare. So in the patient perspective, so we have an AI chatbot, so to interact with the patient, right? And then we have wearable devices, and then personalized genetics. Of course, we have a daily health, so we have daily medicines to in monitoring the patient remotely, and then of course in drug discoveries, and then the genetic research. On the doctor's perspective, so we have a lot of medical records. So we use AI. AI is being used for analyzing these records, right? So, and then of course we have a lot of like data imaging, medical imaging data is being collected, so we can use this imaging for the pre-screening of diseases, right? So, okay, so now we are in facing COVID. So recently a company called Vocalist, so they claim they can use just your voice to pre-screen whether you have a COVID or not. So yep, so it's quite amazing, right? So without doing anything, then you can just collect your voice. The machine learning algorithm will analyze your voice signal and determine whether you have COVID or not. Of course, this whole thing is about just the pre-screening. So okay, so I just want to show you some application of how to use the AI in combating the COVID-19, right? So of course, first is the prediction and forecast, right? So, and then the social media data is being collected. So, and then like company like Blue Dot and Heatmap, so you can use, they use this data to predict, to forecast the outbreak or the spreading of the pandemic. So, and then of course, as you know, so in terms of the contact tracing, so we have our MySejahtera, right? So, and then the next in the hospital, so AI is being used for, can be used for patient monitoring. So like vital statistics, like some clinical parameters can be collected from the patients. And then we analyze this data and use to predict the chance of the recovery and mortality of the COVID patients. So I think it would be helpful for the hospital, right, in managing their resources, right? So of course, in AI, machine learning researchers, since the outbreak, they are developing models to do early diagnosis based on the chest CT scans. So and then of course, AI is being used for the treatment. So like the DeepMind, they use AI to predict the protein structures for drug development. So yeah, so this is some example of how AI can be used like in tackling this COVID-19. So of course, as I said just now, so one of the main application of AI in medicine is for as an assistive diagnostic tools, right? So So it's aimed to detect early detections of some diseases. Of course, it cannot replace the medical specialist, but provide a second opinion. So, but the advantage of AI or machine learning is fast and reliable. I mean, I said reliable is less prone to human error sometimes. Yeah. So, and it's automatic. So, okay. So here, like, so you can see the AI can predict the COVID cases based on the CT scan with a high sensitivity. Okay, so and the deep learning model is being deployed and trained on the multi-modal data like the CT scans and the biological and the clinical variable, which can predict the severity of the COVID patients. So another thing is a company claim, Google, right? So Google AI can already, they claim they already beat the doctors in terms of breast cancer detections. Of course, it's sometimes, right, in some case, right? Not always. And then in the medical segmentation, you can see these images are segmented by a medical doctors. And these are automatically segmented by a deep learning technology. So you can see that look pretty the same, right? So, and then the deep learning also has been used for brain tumor segmentation with quite remarkable accuracy. Yeah. So you can see the some of the machine learning algorithm has already achieved a near human performance, right? So another is a Stanford group. They already developed a deep learning model, so which can classify the heart irregular heart rhythm, which is better than a cardiologist. So okay, so this is another example of AI. So achieving like performance which is comparable to a medical specialist. So another application of AI is it can be used for prediction of a mental health and cognitive traits. So like we'll collect a large number of participants. So and we'll collect their brains, we'll scan their brain. So and then of course we'll collect their cognitive data and the personality scores. And then we will try to train some predictive model to predict whether, let's say, whether they're, just for example, whether there's a good person or. So the main point here is that we can use this for the purpose of education, right? So we can assess the cognitive ability of the students, and also we can use this as a measures of the psychological well-being of a subjects, right? So and then about the personalized medicine, of course, AI is now already achieved a reasonable success in predicting the risk in certain cancer and the cardiovascular diseases, right, from this clinical and biological data. And in the genomic, so AI is used, machine learning algorithm is used for identify the causal gene, so which gene are associated with the disease. And then and it's also being used for like identify the genotype and phenotype correlation. So which are the gene are related to the neuropsychiatric diseases like ADHD, epilepsy, and autism, right? So of course, AI is also being used for identify biomarkers for the drug discovery. So there's a challenge in the AI for medicine, right? Because like here we have it's also a challenge of the big data because like in genetic data we have let's say 100,000 of genetic variants. So in the brain location we have also 100,000 brain locations. So the problem is how efficient the machine learning algorithm can leverage or extract information from this data to make predictions. So this is a very pressing problem. So finally, I will talk about AI research. So some challenges. So of course, the main one is the interpretability and the lack of a reasoning capability. So so the neural networks or artificial neural sometimes like a black box, right? So like in a heart disease, so you can classify an ECG with a very high accuracy, but the medical specialist, what they want to know is the science behind, right? So what is the underlying biology behind? So like which cause a certain disease, right? So, and of course, the medical data is also very noisy, and sometimes it's very small mean it's very expensive to collect the data. And many of these data is unlabeled, right? So, so how there's a challenge to how we can clean up this data in order to build the machine learning algorithms. Of course, we have a hardware constraint, right? So, and the last challenge is also about the data privacy, right? So because we are collecting patient data, so how can we secure the privacy and the security of this data? So yeah, so
Dr. Shin, can you wrap up in a couple of minutes?
Yeah. So sorry. Yes, that's all. End of my talk. Thank you.
Thank you so much, Dr. Ching, for that illuminating talk on AI and its role in healthcare. It's my pleasure to welcome the last speaker of today's webinar. That's Dr. Fazila Sheikh Alauddin, the Senior Deputy Director of the Planning Division from the Ministry of Health. She will be talking about healthcare in the age of disruption and give us an overview of Malaysia's digital health landscape. Dr. Ting, if you stop sharing your screen, then Dr. Fazila can start sharing hers.
I can't share the screen.
Yes, yeah, I think you should be able to do that now.
Okay, thanks.
Thanks so much. And whenever you're ready, please.
Yeah, I'm ready. Thanks, Prof, for the kind introduction, and also thanks to Manesh for inviting me. Can you all see my screen?
Yes, I can.
Okay, since I'm the last speaker, so it looks like I'll be wrapping up the two speakers, great speakers, Hafiz and also Prof Ting. I think that has given an overall view of the capability and potentials of use of digital health and technology. So I'll be just highlighting to you some of the strategic directions, which I think is very important for everyone to understand in Malaysia what's happening, and also a little bit on Health 4.0. I call it Health 4.0. And I think on the event today, we have a lot of students, postgrad students, and also some professionals. I think the future of work is very important to be discussed today, and finally conclude the presentation. A little bit on our country, total population of 32 million. But if you notice, the population age above 65 on the fourth quarter is 7.15%. It's high. We are going towards an aging society that will have more impact on the disease burden. And also the life expectancy also has increased to 74.9 years. So these are some of the areas of concern, and I think it's very important for us in digital health, in the area of digital health, to understand this. Understanding this, then you know how do we address this problem by using technology. For example, in terms of disease burden, aging society, and mental health. Hafiz has spoken about mental health, and we also have issues of people's expectations, integrated care, which has been spoken by the first speaker today, and also issues of financing and sustainability. So these are some of the areas of concern in Malaysia. And these are some of the vision and the goals and strategic plans, but I'm not going to go through it in detail, but just to highlight to you that we have been talking about this since since the since the multimedia super corridor years, which was late 1990s, and until today, a lot of focus has been on digital health. This is the vision. We are hoping to have an interoperable health ecosystem, both public and private. And for those participants, we have dichotomous. We have a public sector and also a huge private sector in health. And I think to have an interoperable health ecosystem, you must have an ICT-enabled environment and also an integrated national health information system. So I'm just going to give you a little bit on Malaysian landscape. This is where are we today? Just now Prof. Kasim in his presentation presented to you how far we have come. But I'm showing you where are we today. There are many systems, if you see in the blue box. There's also waves of AI and IoT, genomics and robotics being used, virtual reality and blockchain. We have initiated the National EMR and the Health Information Exchange Platform. There are a lot of 5G test beds going on now, including for health sector and clinical trials. And a lot of pandemic digital solutions has been used in this COVID-19 pandemic. But the challenges are, a lot of it is silo and fragmented, as mentioned by the speaker earlier also. We have weak analytic capabilities. And if you want to move towards big data and AI and precision medicine, I think this is where we need to strengthen as a country. Many of our hospitals, especially Ministry of Health hospitals, are still manual. And we have many other challenges as you see here. Some of it includes regulatory roadblocks and also long-term sustainability issue. And another interesting thing is with the new technologies, there's also service model disruptions, which is affecting us. And another big challenge we are having today is our pandemic of the century, which is COVID-19. If you notice, today, as of 17th of February, we have surpassed more than 270,000 cases and more than 1,000 deaths. And this is actually not only a health crisis, but also a public health, also a huge economic and social impact. So we really need a post-pandemic comprehensive recovery plan. And to further strengthen our health system preparedness and also towards a resilient nation. So this is some of the digital response that we have done during the pandemic. I've put it in 7 focus areas. So if you notice, we have done many new initiatives, but at the same time, we are also leveraging on existing platform in the area of strategic and risk communication, a lot of use of social media, community engagement. We have started virtual clinics, virtual health advisory and contact tracing. In terms of operational efficiency, multiple systems has been done for insights and foresights. But all this cannot happen without infrastructure upgrade. You need to have proper connectivity. We had to upgrade our bandwidth, and also we had to have some portable base stations near some of our hospitals. We have done a lot of research and clinical trials. Prof. Ting has spoken about it. We are also looking into AI for CT scan and X-ray. There is molecular modeling being done. We did a lot of 3D printing during this pandemic for equipment and also PPEs. Robotics has been used to have a contactless service. And also we are now trying health remote monitoring for positive COVID patients at home. And of course, this year, new vaccine management. So entire vaccine supply chain system and the stock management and also the administration. So if you notice, a lot of this has been done, but of course, moving forward, the roadmap of sustainability of these systems, and once COVID is over, what do we do with this? So the repurposing is also very important. So what is the focus of our future healthcare? There are 6 focus I have put here. Of course, there are many, but these are some that is very important for digital health, quality and safety. illness to wellness is very important. So if you relate this back to Hafiz talk and also Prof Ting's talk, a lot of it can be used towards wellness, and prediction also used towards preventive, and AI is used towards prevention and promotion of health and so forth. Healthcare back to communities, families, and individuals. Bringing healthcare out of hospitals and clinic, of course, require technology, requires bandwidth, so this is where it will play a big role. Innovations and smart solution is very important. Collaborative partnerships, and also public-private integration. Let's take a moment and have a reality check. I think all three speakers, including Prof Kasim, has mentioned this, and this I think is very important. Science and technology is really rapidly developing, so it's for us to adapt and adopt. And we are moving towards a data-centric and data-driven world. We also must understand, especially in universities, the generation of digital natives. They are totally a different breed, and it's actually a big challenge. It's like raising our kids, So what about the digital values and the ethics? And I think we must have new recruitment strategies and new curriculum to adapt to this new generation. Consumer behavior is changing, now everybody wants an on-demand service, a retail-like patient experience. They want the Lazada of healthcare. They want service like Grab, but healthcare has never met this expectation so far. And of course, these new care models will require paradigm change, both on the provider side and also the consumer side. And with that, we really need new policies, regulation, and new models of reimbursement. Is very important. So the future is all about human-techno interaction. We are still not there, but I think moving forward, personalized medicine is very important in moving forward. So these are some of the game changers for tomorrow. I've only put some here. Mobile devices, IoT, cloud, robotics, and so forth. Of course, 5G is also very important. I think I've seen in the question box, people asking about 5G. 5G is very important in healthcare, because of its speed and its low latency and also higher bandwidth, which you can use for remote surgeries and also large files and also real-time monitoring. But at the end of the day, without broadband connectivity, this is almost impossible. So broadband connectivity as an utility has been announced recently, and I think we are all very happy about that. And we must leave no one behind when we are moving forward in digital economy. This is quickly a snapshot of where we are today in Malaysia's digital state. And with this, we know we can use smartphones to tackle challenges in health systems. I just want to quickly tell you there are many national policies. JENDELA is the communication policy. It's very important that we are moving towards 5G by the end of the 12th Malaysia Plan and 13th Malaysia Plan. We must also know there is an sandbox that's going on. So for you, those out there who are doing innovation, you can go into the sandbox, And there's also the new Malaysia Science and Technology Innovation Framework, which we are talking about blockchain, robotics roadmap, and also a national AI roadmap. So as people, as you are involved in digital health, I think you must know these are all the policies that's around. Implementation challenges, everyone has the same implementation challenges, people, process, technology. But what's important is the new challenges. New challenges which is, a lot of it is related to data, related to digital trust, and also related to safety and liability. I think this is very important. But these slides will be shared, I think, so you can look at it and read about it. And another important thing is the role of government. Government plays a big role in moving the agenda of digital health and innovation in terms of leadership, policy, access, talent development, and collaboration. And for those, if you are aware, this morning, the Prime Minister launched the Digital Economy Blueprint. I think that is a very important document. And I think if you have a chance, please go and look at it, where it will bring Malaysia to the next level in terms of digital economy. What about role of university? I think university also plays a big role in, other than your education and training to prepare the generation of the future. University play a role in research and innovation and in industry collaboration, and also to facilitate entrepreneurships and also technology transfer. So finally, a little bit on future of work. Of course, everyone is worried whether the AI will take over our work, our job. Yes, it has been said that machine learning could do work of 140 million knowledge workers, and 30% of middle income jobs will be eliminated. So the worry is there. But are we worried about the future of jobs or jobs of the future? I think this is very, very important. So as a leader in this fourth industrial revolution and also in this 21st century, all of us must have new skills, or must unlearn and relearn, reskill and upskill. I think that's very important. And lifelong learning is also important, and cross-industry is extremely important in this era of 21st century. The future of medical education also must change if you want to prepare the future doctors. So this is the one I took from Medical Futurist, which says that these are some of the principles of future medical education. And I think it's not only medical education, the future of education has to change in this 21st century. So the workforce of the future, especially those who are students in this webinar, I think it's very important for you to have all these skills, future thinking, cognitive skills. Passion is very important, you know. You must have deep passion in things, then work is fun. So with that, I think finally, I would like to conclude this by saying the future of care is predictive, preventive, personalized. This is definitely possible with all the new technology, but we must not compromise availability, accessibility, and affordability. You must remember there is a digital divide, there's a digital gap, and not everyone has access to broadband. So all this gap must be closed, you know. And healthcare is just beyond, we must go beyond just curing disease and beyond the walls of hospitals, but actually keeping people well, I think is the future. And we must have individuals manage their own health. You must have new paradigm of data ownership, privacy, and sharing, especially in AI. New skills and expertise is very important. And those policymakers, we must have rapid response and agile in policy making. Cybersecurity, biosafety is important. And finally, not forgetting ethical and social issues. So I think with that, that is my final slide. Thank you. My email is there for anyone who would like to contact me. Please do so. So with that, I pass back to you, Prof.
Thank you so much, Dr. Fazila, for that fascinating talk and giving us what the state of affairs is in Malaysia and where we need to develop and focus on. So I guess, Nisha, you're going to be conducting the question and answer session now?
Yes, we can move on to the...
So I hand over to you.
All right, thank you very much, everyone. It was a very enlightening talk from all the speakers. Thank you so much. We have received a lot of questions, and as you know, like Mr. Hafiz has had to leave, so he will be answering his questions later through email, or we will be posting them over social media, but he has answered some of the questions in the Q&A pane itself. So if you have posted any questions, just check the answers tab and you may see that your answer have been answered. So while we were talking, some of the questions were being answered live. So do go ahead and check and see if your questions have been answered. But there are a few questions that are left unanswered, and I'll be addressing them here right now. So, okay, so This question is for Dr. Ting. So my question from I'm just reading it out loud. My question for Dr. Ting is that how can we integrate AI and machine learning algorithm for digital healthcare system using blockchain? This is because I'm working on digital healthcare system as my PhD topic. Thank you.
So regarding the blockchains, I think one possible applications of the blockchain healthcare system is about to secure the data privacy from the patients. Yeah. So.
All right. Okay. Okay. So there's this.
Yeah, we can use like this type of technology, like for the data privacy. Yeah, to secure the data privacy. Yeah.
Okay, thank you. Another question is, how about sensitivity to AI to diagnose accurately? How do you quantify accuracy?
Okay, so I think a simple example is like if you diagnose a heart disease, right? You just collected like 100 test subjects. So and then you use the AI algorithm just to predict the whether the subjects have the heart disease. And then let's say 90 out of 100 so is diagnosed heart disease. Then you can calculate the accuracy. The system have a 90% accuracy. So this is a simple way of course, there are a lot of more elaborated performance metrics to quantify accuracy. Yeah.
I see. I think a lot of people, there are similar questions like that as well. There's another question that you have addressed to in the answer panel pane, where it said that how can AI be effective in treating and diagnosing diseases such as autoimmune diseases that have multiple contributing factors like genetic predisposition, environmental factors, and immune system dysregulation?
Yeah. I think according to the recent research, so actually many of the machine learning models actually achieve like a good predictive performance in the simple scenarios, like the classification of normal cases with the cases and the normal controls, right? So, but the challenge is how can we integrate this type of data, because this type of different data, like they are in a different form, right? So the challenge is how can we integrate a different kind of modality or data modality to improve the diagnosis. Yeah.
All right.
Can I just talk about, so I think one of the issues is that in genetics at least, you have these polygenic risk scores for non-communicable diseases. The problem is that most of those scores have been focused on European ancestry populations. And so there's a lack of data from populations in Africa and essentially non-European populations. And so those scores are not very accurate when you try to translate them to like populations in Malaysia. So I think that's where the focus is going to be, try to reduce these inequities, build up more data sets and more basically based information on which to develop these AI models, because unless you have these preliminary data sets which you've analyzed, it's really difficult for AI to predict a polygenic risk score. So that's why I think biobanks and analyzing healthy populations is where you need to focus at least the research efforts on.
All right, thank you very much. Yeah, just I'm going to ask one of these questions. It's just an open floor question. Just feel free to jump in if you have anything. So it says that how different are the approaches used in digitally managing non-communicable diseases when compared to communicable diseases?
Dr. Ting, you want to take that one?
So can you repeat the question? Sorry.
Sure.
So, yeah.
It says that how different are the approaches used in digitally managing non-communicable diseases when compared to those that are communicable diseases?
You mean in terms of, okay, so I find the question.
Yeah,
So,
like digitally.
how different are the approaches in determining non-community diseases compared to the community diseases? Yeah, I think Dr. Fasila is the
Oh,
better
okay.
candidate to answer this one.
Right. Yeah, okay. I think the principle is the same, you know, in managing either both in communicable and non-communicable. But in communicable diseases, there is also element of prediction, elements of visualization to see forecasting and so forth. But in terms of principle, I think it's the same. You use it you can use it for prevention, you can also use it for treatment and so forth.
Yeah, I think the additional aspect probably in communicable diseases
Yeah.
is contact tracing, like you see in COVID,
Yeah,
which
correct.
is really contact tracing is not something
Yeah.
important for non-communicable diseases. In that, his family history is probably more important than where you live and who are you in contact with.
Okay, I think we have time to go through a few more. So Dr. Fazila, I think this one's for you. Please highlight how would the government cover the gaps of 3As? I agree, reducing disease burden will reduce the economic burden. Don't you think accessibility of healthcare facility will surpass availability and affordability of digital tools in rural areas? And how about cost effectiveness? Please highlight about that.
Oh my God, such a long question.
Yes.
I think the question.
I think we can go through the 3As first.
Okay, all right, okay. I think the question is talking about accessibility, availability, and affordability. Am I right? Yeah. In terms of accessibility, I think there are many aspects of accessibility. It's not only in terms of whether the service is there, the hospital is there, the clinic is there, but it must also be financial accessibility. You know, whether is it affordable and so forth. So actually all these three is very interrelated. So government plays a big role in making sure all the facilities are available, and all these facilities have the minimum standard and minimum services that is required, and it's affordable. Right now, I think it's affordable as of today because it's a tax-based funded. In the public sector, it's affordable and it's heavily subsidized. But in the private sector, of course, it depends on either out of pocket and also insurance payment and also employee by employer. So government has have to ensure that that everyone has we must not leave anyone behind. Be it rural areas or rural, urban, and also you must not leave behind the old and the young and so forth. So actually it's a very tough thing to do, but we have to manage all three together. So I think we are also hoping for the next 5 to 10 years, we do some reform in healthcare financing. That's one big thing that is coming, and also improving the accessibility to the facilities, increasing our services, making sure the doctors are enough, and also public-private integration. I think is very important also to improve all the 3As. Yeah. So there's a lot more work to do in these three areas. But there are also other people to play a role. It's not only Ministry of Health, okay? Yeah, in terms of connectivity, in terms of roads, in terms of social welfare, it's a whole of government is involved in making sure the 3As is realized. Yeah.
Thank you so much. Okay, so here's another one. With the rise of healthcare digitalization comes the rise of cybersecurity threats to not only doctors, but also the patients. What can be done to mitigate cyber threats in the healthcare industry?
I'm not an expert in cybersecurity, but cybersecurity, it comes along together with privacy issues, confidentiality issues, all must be taken care of. That is why we follow all the standards that has been laid out in terms of security, and we also make sure that we do yearly compliance on it. But cybersecurity is a threat. It's a huge threat to the health sector, especially we are dealing with personal data. So I think first of all, awareness is very important. Making sure all the laws and regulation is adhered to, and making sure all the technical aspects of security is also done. That's what these are some of the areas that we are looking at.
So maybe I can add to that. So in terms of the ensure the security of the data, so we can use some cryptography, right? So and to encrypt the data. So it's difficult for the hacker to
yeah. I mean, there's a lot of cybersecurity guidelines and things you do when we are developing a system, so it is a very strict, stringent process, correct?
I see. Thank you. We can have just one last question. I'll read it out. It says that, to what extent can we expect accurate AI involvement in prescribing treatments, not only diagnosis?
Okay. So I think the diagnosis is of course, is the common application of AI, but regarding the treatment is more a complex problem. So usually we also like collecting the treatment outcome as the data target, and then we try to collect the data from the patients and then the treatment outcome, and then we can train the model to kind of predict the treatment, the outcome of the outcome of the treatment. Yeah. So yeah. So I think how accurate it is depend on the disease and the availability of the data you have, right? So if you collect a large amount of data, and then and provided we have a very efficient algorithm, so then we can predict the outcome of the treatment. Yeah.
I think, Prof. Ting, at the end of the day, is what data we feed, isn't it?
Yes.
Right. So yeah.
And especially we need to clean up the data, right? So
yes,
and
exactly. That's how.
All right, thank you very much. I think that brings us to the end of the Q&A session. But before we end, I would just ask the speakers and the chairperson just to share a take-home message as experts to the public about digital health.
Thank you, Nisha, for that conducting the question and answer session. So I think it was a really informative session for me. I mean, it's really important to know what are the initiatives that are ongoing, what are in telemedicine and from the Ministry of Health in Malaysia. There's a lot of scope for growth. Happy to learn that we'll still have jobs, especially in these in areas where you are doing a lot of data analytics and genomic sequencing and AI. And so I think those are skills that the students need to then learn so that they're in a better position for getting these jobs as they come up. And as I think the Ministry of Health is outlined in the next 5-year plan, these are the areas that they're going to be focusing on in the digital economy. And these are areas where there will be a growth of jobs. And so I think that's where the younger generation should really focus on, and the skills that Dr. Fazila highlighted. I think Dr. Ting gave a great overview of what are the potentials of artificial intelligence. Of course, the caveat is that if you feed garbage in, you'll get garbage out. So you need to make sure that your data is really clean and tidy, and you do a lot of testing before you bring it into the market, because you don't want something that fails spectacularly. And I think the promise of telemedicine, which is, I think, what Hafiz really outlined in his talk. Sorry, he wasn't there to answer all the questions that you guys had. I'd like to maybe give a minute each to Dr. Fazila and Ting to give their views.
Yeah, my takeaway, especially for the students there, is have passion. Have knowledge, read. I always will say read and read, I still read. I read 5 articles a day, so you must read, and have skill, have new skill, have upskill and so forth, and finally have the right attitude that I think is very important. Again, good luck to all the students out there.
Thank you, Dr. Fazila. That was an inspiring message, take-home message for the kids. Dr. Ting?
Yeah, so I just give a take-home message. I think AI is really transforming the healthcare sectors, and I think the future is about explainable AI, so which enable AI to have a reasoning capability. So, but having said that, so I think AI is still as an assistive tools, so which is a complementary to medical specialists. It's not replacing the medical specialist. Yep, it's for me. Yep.
Thank you, Dr. Ting.
Thank you very much. I think I'm just going to share my screen because I just have a few more things.
Yeah, sure. I'll hand it over to you. Thank you to the organizers as well.
Thank you so much. Okay, I'll just. Ooh. Okay, everyone. Well, this basically leads our webinar to an end, but we don't want you to leave yet because I do have a few more things to go through. So starting with our evaluation form. So your feedback has always been very helpful, so please take a little time to complete our short evaluation form. That is, the QR code is being displayed on the screen and the link should be shared in the chat. This will also be sent to you after today when we will be sending out the participation certs. So thank you very much, and please do let us know how we did in our evaluation form. And just to let you know, the 2021 Committee of Monash Science Symposium is signing off today. It has been one incredible journey for the entire team, and I can't say it was easy considering the circumstances we all have been facing. But your presence in our webinars from across countries, the fantastic engagement, and the constant support makes it worth a whole lot more. So thank you. Now I would just like to take a moment to congratulate our chairpersons of the committee, Herman and Isra. They're dear friends of mine and two of the kindest people I know. So to all of you, they may have been working in the background, but we owe it to them to lead our team to this very moment of triumph. So congratulations for the huge success. But please make sure that you follow all our Monash Science Symposium handles on social media so you can stay updated for the future MSS events from the new committees. And if you haven't already visited our website, please head on over to monash-sciencesymposium.com to learn more about Monash Science Symposium and the committees that are to come. So with that, stay safe with your families and friends, stay curious, and I sincerely hope that we meet again. Thank you very much, everyone.
Thank you. Have
Thank
a nice
you.
weekend, everyone.
Oh, okay. The speakers and the chairperson, could you please have you so that we